So my name's Neil Cottrell. I'm Senior Lecturer in the School of Pharmacy, and I get to see the pharmacy students in their fourth year in their final semester, where I deliver a course called Integrated Patient-Centered Care. And what I actually do within this course, by the time you guys get to me, you are the experts in medicines and their uses. You have a phenomenal amount of knowledge about medicines. So my role in this course is to get you to integrate and apply your knowledge. So that's what this course is all about. And the way we do that is we get you to problem solve. And your problem solving is resolving problems patients have with their medicines. And we do this through creating scenarios, and these scenarios relate to real life, so they relate to real patients, and they relate to the context of the workplace that you're going to be confronted with these problems. I have a fantastic bunch of experienced tutors who facilitate these tutorials, and we manage to do it, we think, in a very fun and engaging way. And the feedback we get from the students is that they really enjoy it. So I thought the best way to show you this was to describe a case for you as an example of what we would do. So you imagine a lady, Miss Dorothy Tune, who comes to see you, or whom you were asked to see by her family doctor. Now Dorothy is a 78-year-old. She's in a nursing home, and her family doctor would like you to do a review of her medication. And he gives you information about Dorothy's medical history. So Dorothy has depression, diabetes, she's got stomach ulcers, and she's had a heart attack. And the problems that the staff at the nursing home have at the moment is that Dorothy is very agitated, she's very confused, and she's had a number of falls. Now the other information we would give you as students is the medications that Dorothy's actually taking. So you can see here that Dorothy's on 8 medications, and you can take it from me that those are medications you would expect somebody with Dorothy's medical history to be prescribed. And we might also give you a picture of Dorothy as well. Clearly this is not Dorothy, but this is another way of introducing a bit of fun, and I also want to reassure you that patients, 78-year-old people in Australian nursing homes don't really look like this. So what we would then do is you would work in small groups in the tutorial with this information to identify whether Dorothy's problems, so that is the issue of Dorothy with her agitation and falls, could be related to any of her drugs. So have any dosage changed recently, or any of these new drugs? And what you would do in identifying whether the drugs could be involved is then thinking about the options that you might have to address these problems. And there might be a number of different options you could take. And then finally what we ask you to do is distill down to one option, which is your management plan. So what are you going to do to help Dorothy? What we then do is get you from your small groups of 4 or 5 students into the larger tutorial group, which would contain anywhere between 25 to 30 students, and you discuss with your peers in the larger tutorial group your findings, why you created the management plan that you did, and also who else might be involved in the care of Dorothy. So you would hear the management plans that your peers have come up with as well, and you might pick other people who would be involved in her care, such as a physiotherapist or an occupational therapist, but might find your colleagues have also identified other healthcare professionals who would be involved in Dorothy's care. The other thing that we do is we also have some fabulous teaching facilities where we have some simulation or mock pharmacies. So this is an example of a tutorial room, and in this tutorial room you can see at the back in the left hand corner that we have what we describe as a mock pharmacy, and you'll also see that this has one-way glass on it so that when you go in there you can't actually see out. And this is what the pharmacy looks like, and you can see here we've got 2 students who are role-playing pharmacists and another 2 students who are role-playing patients who've come in to request some advice from the students who are playing the pharmacists. So you imagine this is you as the pharmacist, and we put you into that mock pharmacy. We tell you that you're going to get certain people coming in to see you, but you are the pharmacist, and in this role-play simulation It's up to you to decide what you're going to do. So you imagine Mr. Smith comes in to see you, and as you can see from here, Mr. Smith clearly has got a bad cough and a bad cold. So you would then interview Mr. Smith, reassess his symptoms, and decide what is the best advice that you can offer him, and that might include selling him a product. So having seen Mr. Smith, you then get Mr. Jones comes in to see you, and this time Mr. Jones, rather than complaining of a cough and cold, Mr. Jones has got a direct product request, and he actually wants to purchase some ibuprofen. So clearly you've got to ask appropriate questions of Mr. Jones to identify why he would like to buy this analgesic. But you imagine while you're talking to Mr. Jones, before you quite finish, Mrs. Small comes in to see you, and she's brought her son Johnny, who you can see he's crying and he's hurt his knee because he's fallen over. So you've now got to sort out Johnny, and whilst you're helping Johnny, the phone actually goes, and there's a doctor on the phone who's ringing you who's got a problem. So it's an opportunity for you to be in a real context, albeit in a simulated environment within our mock pharmacy. And even though all this is going on, guess what? We're filming you at the same time as well. And we can actually then give you that film so that you can go away and reflect on your own performance and how well you did. And we'll do that within the class, not with the filming we've done, but you'll get feedback from your peers, so your fellow students, and also from the tutors about your communication. So you would get asked, what do you think well? What could you have done better, and how would you have done that? And this is really important because you're in this simulated environment. We're not assessing you. It doesn't involve real patients. So if you make mistakes, you actually learn from those mistakes, and nobody is harmed by it in any way. The recording is actually for you to keep so that you can reflect on your performance. So this is what we do in the final semester in the 4th year of the pharmacy degree at the University of Queensland. And we have the integrated patient-centered care, which is all about integrating and applying your knowledge in a simulated workplace environment. You never know, maybe we'll see you there.